What can trigger atrial fibrillation? 5 common suspects, created by UPOlife. Atrial fibrillation, also called AF, is one of the most widespread heart problems on the globe. AF, recognized by the quick and irregular heart rate, can increase the risk of experiencing heart failure, stroke, or other cardiovascular complications. Certain triggers can result in an AF episode. When an episode happens, the heart rate can range from 100 to 175 beats a minute, while a normal heart rate is 60 to 100 beats a minute. However, once you figure out the triggers, you will be more than capable of keeping your condition under control. Here are the most impactful AF triggers. 1. Stress and emotional instability. According to the National Institutes of Health, stress and psychological burdens are red flags for AF. They can affect the heart rhythm, topple your appetite, tighten the muscles, and trigger an episode. A typical problem is stress at work. Clinical reports show that job-related stress can increase the possibility of an AF episode by 50%. If you want to keep your bodily functions under control, it's a good idea to start with your mental health. Try to overcome anxiety and replace negative emotions with positive experiences. In situations when you are too stressed, you can come back to these positive feelings. 2. Exhaustion and disease. Whenever the system isn't functioning at 100%, you are very likely to experience an AF episode. In the case of insomnia, disease, or bacteria, the heart rate tends to fluctuate and put stress on the heart. To avoid these triggers, you should sleep and eat well. Highly nutritious foods and beverages can keep these triggers in check, while sleeping will accelerate the body's natural rejuvenation process and aid it heals quicker. 3. Polluted air, smog, and contaminants. Studies show that the longer people are exposed to pollutants, the higher their chance of visiting the hospital for an AF emergency. Experts believe these triggers can damage the walls of the blood vessels, restrict blood movement, raise blood pressure, and put a lot of pressure on the heart. If there are too many contaminants present in the air, try to stay indoors as much as possible. If you really want to make a change, it's a good idea to go out of the city and relax in the countryside. This will clear the lungs and help the heart recuperate. 4. Alcohol and heavy drinking. Anything from wine to beer can be a serious issue for patients with AF. These beverages can affect the vagal tone, which is the function of the vagus nerve. The alcohol can increase vagal activity and result in an AF episode. So, to be in complete control of your cardiovascular health, start monitoring your alcohol intake. Heavy drinking is out of the question. It's better to drop the habit completely rather than to expose the system to unnecessary risks. 5. Wrong physical activities. Excessive workouts can put a lot of strain on your cardiovascular health. Patients with this condition can still exercise, but whatever they pick has to be easy on the heart. Anything that is too vigorous is not a good idea, like high-impact exercises, heavy lifting, long-distance hiking, and running. Instead, you should opt for low to moderate exercises, like light lifting, jogging, short-distance hiking, and walking. After getting diagnosed with the condition, it's a good idea to start with short-period activities from 5 to 10 minutes. Once the body gets comfortable, you can slowly increase the length of the activity. Final thoughts. Living with this condition is not an easy feat. However, if you get the hang of the triggers, you will finally feel more comfortable in your own body and learn to control the episodes. Learn more about how to evaluate your heart health and manage your heart condition at home by visiting UPOlife.com.